Good governance promotes equity, participation, pluralism, transparency, accountability, and the rule of law in a manner that is effective, efficient, and enduring. Key to Uganda's system of governance is low capacity of the citizens to demand and hold leaders to account for their actions, and limited or non-involvement of the governed in decision-making. IDF supported programs to enhance good governance by empowering citizens to hold their leaders accountable in service provision and delivery. IDF partnered with Mayank Anti-Corruption Coalition Macho to address challenges in water supply and sanitation and maternal health service delivery in Arua district. Macho utilized community-based monitoring and reporting, frontline engagement, and local authority engagement. This resulted in revitalized community-led governance in the protection and management of water sources and user fees, increased awareness of rights and responsibilities, and in turn, the capacity of communities to influence and hold duty bearers accountable.
We have been intervening at water sources, boreholes, and springs. We had 19 water points. About 5 of them had E. coli, and most of these water sources which are along the Nile Basin.
Communities, users, and committees had all collapsed. Facilities had broken down, and yet this is the only borehole at this point. The alternative source from this place, when the borehole broke down, was River Nile.
Ochokori mvuzase ama bakandra merdini mvui amado yidi ni mvu macho ni do amane yidi ni diboris amado yidi nayo.
And whenever we face problems, especially with the borehole, normally the counter rescue, the organized community dialogue, we sit down, we identify our problems, and together we also come up with solutions as to how that problem can be rectified.
Macho also contributed to improvement in health service delivery.
One health center, which we constructed as Ribo Sub-County local government, it took us some 10 years to operationalize. But when Macho came in, we were able to put the district at a task and see to it that that health center kicks off.
We opened with the help of Macho. I didn't know how Macho had been running, but when Macho heard that we were posted here, they wanted to know how this health center is running. Does it have facilities? Does it have things, the staff? And does it have a water system? They have been following these things up.
Mama tado digarane baji pare mana angiru muka askumbetia diru malaria akoini siru ma pochi dajizolo angi deben.
The time we're winning with the Macho, I think they have done a very commendable job in terms of reminding us of our responsibilities, especially issues to do with the broken water points that have even lasted for long. Issues to do with the poor services in health centers, issues to do with the staffing, issues to do with the non-functional health facilities.
IDF also partnered with Karambe Action for Life Improvement, KALI, to educate and empower women and youths in Kasese district with knowledge about their health rights and responsibilities, and to impart skills to enable beneficiaries claim these rights. Neighborhood assemblies were an effective way of promoting empowerment, participation of citizens, and improving the quality of interaction among stakeholders. They provided a platform for creating awareness, responding to critical issues affecting a given community, sharing vital information, providing citizens with the opportunity to identify and propose solutions to concerns. Through neighborhood assemblies, dialogues, and live radio discussions, residents of Nyakiyumbu sub-county were able to engage the district leadership on issues of the provision of a maternity ward at Mushenene Health Center 3.
And the best thing with the Kale, they have been making some follow-ups of what we have always been telling them. Like in this sub-county, we are having a problem of lacking the health facilities. So they have always assisted us and they have always gone with us, lobbying at the district level. As I talk, we are waiting for a response from central government anytime.
Kali also empowered communities to be vigilant on provision of services by different stakeholders, and as a result, community members were able to identify and expose a case of corruption at Kyondo sub-county.
We had a sub-accountant by names of Kazige Faith and the sub-county chief by names of Masereka Dan. And we realized that they had swindled an amount of money equivalent to 12 million. We knew it because we had committed that specific amount of money on a certain program. We had to report to Karambe Action for Life Improvement, CASOSAT. We resolved to go to the Inspectorate of Government.
All those processes, we engaged them, we attended them until the two acknowledged the mistakes they did, signed to pay off the money, and they agreed the schedules of payment.
Gwedji empowered women through the SASA model, an approach of mobilizing communities to discuss social issues and create change using local solutions, and this has empowered women to be agents of downward accountability, a unique situation in a society that is dominated by men.
Gwedji as an organization is known to us as a district in working with the women. They worked with the women groups in very many ways through saving on issues of gender-based violence, on issues of livelihood and economic empowerment, on issues of rights of the women, and including also the youth. These are the special interest group.
In a period of 3 years, Gwedji supported 15 women groups, out of which 4 emerged into CBOs working to improve service delivery.
Punyima Gwedji umenewa mewa no ngin maduong we cha wa ti ker maduong pikena gen go nyor yo ni wa tim ki to er wa wan char wa mon mo ko wo min wa twer la ka da ko ngam la ka da ko tela ki la ka duwa ta pien da pe pek me ki luor mai kam me kumbe mo wa lo ne wa ti ki jo ken mo katimi chu kita kar mi chung kumbe nung tieni wati ma mon wi wati akar mi chung mi beru chalu tera iwi tera maduong ma papa.
On the 21st of August 2015, Bunyama Women's Group in Gulu District petitioned Gulu District local government over hepatitis B vaccination following an outbreak of hepatitis B in Ajuko village, Pakwelo Parish, Unyama sub-county. The petition led by the women under the project was signed by 300 people. The women compiled the trend of hepatitis B since 2014 until July 2015 and filed the petition at the district